Most people hear about WHO most when you have an incident like Ebola or influenza before that and SARS before that. So it is an important function of WHO to be the leading body in trying to take the right steps when an outbreak occurs. If you're the Minister of Health or a senior official in the Ministry of Health and you can get one of your colleagues, or yourself indeed, into a WHO job, then you're multiplying your salary several times. So there's a big incentive to not necessarily put the right people in the right place. So that tends to happen in WHO. So in the Ebola emergency, when Geneva took control, they sacked the 3 heads of country offices, which seemed to indicate they weren't quite the right people to deal with that emergency. You know, if you take the US, Britain, France, a few other countries, and big foundations like the Bill and Melinda Gates Foundation is now just about the biggest donor to WHO, bigger than, for instance, the USA itself. So if those countries decide to do something, then they can essentially bring about change in the organization. If they're happy with the status quo or not sufficiently motivated to change it, then the organization will stay as it is. In that sense, I mean, they're the key, as the key funders, then whoever pays the piper plays the tune. Should one not be able to run an organization with less than 33% of its budget taken in administration and management? And the reason so much is taken by administration and management is, one, it has 7 governance mechanisms. They all have annual meetings, other meetings, all the papers have to be translated into several languages. It has multiple different donors, multiple different projects. All of these add to the administration and management burden. So our thesis was that it's necessary to reform WHO and its governance and structure. That would be a way to reduce the amount that's spent on administration and management.